everyone, welcome to the Smile Project, podcast from the School of Dentistry, IMU. Thank you for joining us today. This section of the Smile Project is called the Dental Bites. Tune in to this section for bite-sized learning on the go. Today, we have Dr. Lew Pit Hui, a periodontist from IMU.
Hi everyone, I'm Dr. Pit Hui.
For today's episode, we'll be diving into the topic of periodontal surgery. When is the right time to consider it? Is it a must for every case of periodontitis?
To kick things off, let's start by understanding what periodontal disease is and why it is important for us to address it. So as we all know, periodontal disease is a chronic inflammatory disease associated with a dysbiotic dental biofilm. It is characterized by both soft and hard tissue destruction around the teeth. It is a major oral health problem affecting 94% of the Malaysian populations, as it will lead to irreversible attachment loss, bone destructions, and even tooth loss if left untreated. Before we jump into periodontal surgery, it is important for us to note that in many cases, early-stage periodontal disease can be managed with just non-surgical therapy, like scaling and root surface debridement, improved oral hygiene practices, and regular dental follow-ups. These interventions aim to control the disease progressions and may be all that's needed to control the disease. So, when should we really consider periodontal surgery as a treatment option? Is this a must for every case? Well, periodontal surgery is typically considered when non-surgical therapy has not effectively controlled the disease, and when there is a significant damage to the tooth supporting tissues with persisting clinical inflammation that can't be resolved by repeated instrumentation. Surgery may be recommended when periodontal pockets around the teeth are too deep and cannot be adequately cleaned with scaling and root surface debridement alone. So, by performing periodontal surgery, it allows us to gain a better access for adequate subgingival debridement. In certain cases, periodontal regeneration therapy can be carried out using membrane and bone graft materials with the goal of restoring the tooth supporting tissues which have been damaged by periodontal disease. Second indications of periodontal surgery is when there is gingival hyperplasia or gingival overgrowth that has led to an impaired access for self-performed plug control by the patient. Hence, periodontal surgery like gingivectomy can be done to remove this excess gingival tissue. In some cases, periodontal surgery may also be performed for cosmetic reasons. For example, in the case of gummy smile, aesthetic crown lengthening can be performed. Another indication is when the patient is suffering from gum recession that has caused an unsightly appearance. Procedures like recession coverage or gum grafting can help to restore a more aesthetically pleasing smile. In conclusion, periodontal surgery is typically considered when non-surgical periodontal treatments are insufficient to manage a gum disease or related issues. It is not a one-size-fits-all solution. A proper evaluation and personalized treatment plan should be made before embarking on the surgical procedures.
Alright, thank you Dr. Lew for enlightening us with the topic of periodontal surgery. That's all for today's episode, and remember to tune in for the next episode of the Dental Bites.